Number four, guys, we are on series number 4 of our Prehab recovery series. The idea of this series is to keep you out of injury and to give you some tools for your toolbox so that you can stay healthy during your training and fitness. Today, we're going to talk about the lower back. So we've done the ankle and foot, we've done the knee, we've done the hip. We are now at what's called the lumbar region, the lower back. The lower back is what's called the stability joint. And joint integrity means we want every joint to do what it's designed to do. The lower back is not designed to move a lot. You get a little bit of lateral motion here, a little bit of forward flexion and extension, but not much. Most of your movement comes from the thoracic region for the back. The lower back and the core is all about being strong and stable. When it's not able to be as strong and stable as it would like to be, it then becomes a mobile joint, and that's where you get injuries or repetitive use stress on the back, okay? What can you do? How do you fix it? The first thing you want to do is you want to address your posture. There's an easy way you can adjust your posture, okay? So I want you to make your hands here. One goes right under the belly button, one goes right at the center of the sternum. You turn to the side. You're going to roll your hips back. Here is a nice neutral spine for my core. I want you to think about imaginary lines. If these lines intersect at any point, if they continue to intersect, let's say if you're here, that means that the lines are going to intersect if they keep going. That means there's stress somewhere in the chain. If they're here, they're not parallel lines. They're going away from each other. So you want to think about finding that neutral spine where the lines never intersect. That's one thing you can do when you're sitting. If you're sitting in a chair, you can sit and recline, but keep those lines in neutral spine, or you can stand. So if you're standing in line at the grocery store, there are crazy lines at the grocery store right now for some reason. If you're standing in line, just stand in line, do a check. Just see if your posture's here, or if you're slouching, or if you're here. Do a quick posture check. What you do throughout the day determines the stress that your body sees. The other thing that you can do is core strength. Your core has got to be strong. I hate using the word core because it's so trendy and it's so catch-all and no one really understands what it means. Let's call it midsection strength. The strength of your hips and lower back. It's the connection point between the lower body and the upper body. If your lower body is really strong and your upper body is really strong, it has all these shear forces ready to go, but this section here is not ready to support that. One of the things I do with training my clients is make sure that the lifts and the movements we do incorporate some type of static core loading. Whether it be planks or heavy squats, you're still using your core. It doesn't always have to be sit-ups, crunches, or cable twists. You can mix it up, but you have to be mindful of the position and posture that you are in. So there's two types of bracing I like to talk about. One is what's called the transverse abdominal bracing, where if you find your hip bones, they're right there, you pull in, and if you imagine that you're trying to squeeze on a pair of pants, if you've ever been to PT, you've heard about TA bracing. You're going to pull your belly button to you, and when you do that, you should feel on your fingertips there a little bit of pressure. You're using your transverse abdominis muscle, which acts as a girdle, to help brace everything in. There's a few exercises where you can do that to engage the TA muscle to help strengthen your core. It helps protect the hips and the lower back. This is great for a lower level exercise. This is great if you're doing a little light lifting or if you're standing, okay? The other type of bracing that I emphasize is all about raising the intra-abdominal pressure. If you think about a water bottle and it has no air in it and you go to squeeze it, it collapses. If you think about a water bottle where it has air on it and the top is on there tight and you go to squeeze it, it does not collapse. That's what we want to create when you're lifting heavy or you're doing a big lift, is that intra-abdominal pressure. What that means is it means that your body is going to be locked in, you're not wiggling. One of the things that injures a lot of people is when they're under stress and they're loaded with weight and they wiggle, that shift is going to be picked up somewhere on the spine. If you have that intra-abdominal pressure, everything is tight. The other plus for the intra-abdominal pressure bracing is if you have a belt on. The belt is not there to support your back. The belt is there for you to breathe in a deep breath and push your abdominal wall out into that belt. So if I have a support belt on and I'm doing a big lift, I take a deep breath, the Valsalva method, and I push into that belt the whole time I'm doing my 5 seconds. Remember, this isn't a long-term thing. You breathe, you lock it in, you push 5 seconds, and then you relax, and then you set your core again. Over time, that trains your abdominal wall, that trains your obliques. That means that when you get ready to lift out in nature and you do a functional lift, you're able to brace your core and you're also training your body to do that second nature without having to think about it. So the two types of bracing are abdominal bracing, TA, where you pull in and hold, And then the other bracing is the opposite way. So if you're doing a squat, you're here under the bar, you take a deep breath and you push out. It's not something that happens overnight. The more you work at it, the more you'll get used to it. Just be careful with the Valsalva method. You want to make sure that you have healthy blood pressure and that you're not getting too lightheaded and pass out. That's one of the concerns with that, because it does raise your blood pressure. But here's how the body handles that. Over time, your heart actually begins to be able to do more forceful heartbeats, so your body can handle that change in blood pressure. Stronger people are harder to kill. I always say that because it's the truth. The stronger your body is, the more adaptable you are, the more stressors you can place on it. But you don't go 0 to 100. You go 0, 1, 2, 3, 4. It's a step-by-step process, okay? Bracing, posture, core control, those are the biggest things you can do. Once you are noticing pain in your back, you want to make sure to difference between, is it chronic, where it's going on longer than 6 months, or is it sharp, acute, where it just happened, okay? That's one of the things you want to work with your health professional with to determine the severity of what you're feeling. The back is very unique. When the back is fatigued, it presents often as pain. So when your quads or your biceps are sore and they're fatigued, they just feel like, oh, this is muscle sore. When your back sometimes is fatigued, it'll actually feel like back pain. So you have to be able to differentiate, is this back pain because I've injured myself, or is this muscle and posture fatigue that I'm feeling? You'll be able to know when you're working with your health provider, okay? Once you're having a little bit of soreness or tightness, things you can do to help. Self-myofascial release. We'll cover a couple of the techniques today. Things like lacrosse ball work on the QL and some of the larger lower back muscles. Gentle foam rolling. The foam rolling, I had a great question asked on LinkedIn the other day. We have a LinkedIn account as well. Someone said, what do you do if you're overweight and you're not able to do these exercises? Modifications. Use a handheld device. Get with a trainer that can show you. How do you position your body where you're not going to injure yourself? Okay, that's a great question. I really appreciate that being asked. As always, after the foam rolling and soft tissue work, you can do gentle stretching. For the back, if it's acute injury, meaning you just did something and you feel it right away, stop what you're doing. Ice is nice. Ice is the best thing to do for acute, right on the spot injury to help kind of bring some of the swelling down and ease it. If it is chronic pain, discomfort, where you're feeling this for 6 months, weeks at a time, try an ice heat mix. Do ice for 5 minutes, heat for 10. Ice for 5, heat for 10. Remember, these are tips. If you are feeling chronic or acute pain, reach out to your provider, your doctor. Let them know, hey, this is what I have going on. What would you recommend? Ask them what they would recommend. Ask them, get them to talk to you, because you're the doctor's best line of treatment. The doctor will listen to you, and often we know what's going on. If we use the right words and communicate, we can help that provider. So these are tools to help you communicate that lingo. Okay, so today I'm going to show you some foam rolling and some stretching techniques for the lower back. Okay, I'm sorry I have to talk this stuff because that way you understand. Thanks for tuning in. Make sure you're writing this stuff down, guys. This is free information. It's yours. I want to be able to help you on your journey. Do not miss out on this. Make sure you're sharing this to your friends as well. Okay, and then the last thing I want to talk about before I show you the stretching techniques is spinal decompression. So anytime we're standing, anytime we're sitting, we have this beautiful force that exists on the planet Earth, and it's called gravity. Gravity is always giving us compressive forces, always pulling us down. If you do things like walk, hike, run, lift weights, you have so much compressive forces on the spine. It's just pushing you down. Spinal decompression. It's a great modality. So the way that the spine heals itself is the disc actually pump fluid. As you walk, as you move, this fluid helps the spine to heal itself, to recover. We can help aid that through motion, mobility. We can aid that through what's called spinal decompression, either by going on an inversion table. Sometimes the inversion tables are tough because they may make you feel lightheaded or dizzy. If that's the case, or you don't have access to an inverse table, you can lay back, lower back on a stability ball and stretch out the spine. You can jump up on a pull-up bar and just hang. You can do back extension. You can have a little weight on your legs and just hang. Whenever you do spinal decompression, start with a couple seconds and then work up to longer second holds. It is a stretch, so you may feel a little muscle soreness. Don't rule it out as, oh, this doesn't work because it hurt. Sometimes when you adapt to something new, your body will say, hey, I feel something a little different there. Give it time. Like anything, never 0 to 100. You have to do steps. You have to work up to the next level. Day one of grade school, they don't go A through Z. They teach you A, B, C, and you learn that. That's the same way you have to do your progression in exercise and recovery. The other thing, modality that I've been getting into over the last few years is chiropractic treatment. Make sure you find a great chiropractic doctor. They're able to address what's going on. If there's any joint, spinal irritation, they can also help you identify what is your lifestyle, activities of daily living, and make recommendations. Our local doc that we use here in Williamsburg, I love Dr. Roth over at Williamsburg Neck and Back. I worked with him for 2 years, and the amount of knowledge that I learned there has been priceless. So some of this stuff I've learned there, love to share it with you guys. If you're having chronic acute back pain, go see the doc. Dr. Roth is your guy, Williamsburg Neck and Back. Let's get started. So, I have 2 of our favorite tools. We always use these guys. Here it is again, your foam roller and your lacrosse ball or tennis ball. Let's start with the tennis ball, lacrosse ball on the wall first. So what you're gonna do is you have these 2 big muscles here. QL, quadratus lumborum, you have your spine. We're gonna take this ball, we're gonna put it on our QL. We can also work a little lower by what's called the SI joint. Those 2 knobs there are your SI joints. You can work up a little higher, a little lower on the glute there, but we're gonna focus right through here, okay? Remember, everything is connected, so you may be having lower back pain, but it could be coming from the hips or higher up, but today's focus is the core, lower back. You're gonna take this ball, you press it against the wall, and you lean on it slightly. You don't wanna press too hard on the kidneys, so you're not gonna be way over here on the side. You're gonna be on those tight muscles, those tight, 2 ropey muscles. And you just scan up and down. When you feel a tight spot, for me, I actually feel something a little higher up there. I would hold it. Remember, you're not on the spine, you're not on the bony parts of the back, you're on the muscle. I would hold that bad boy about 30 seconds to a minute and then move around. You can even get close, like I said, to the SI joint. That feels really good usually. Do both sides. Do your left, do your right. You can also do while you're here. It's not a bad idea since you're on the wall to do the piriformis, side of the hip back there, and the TFL. Not a bad idea. Go ahead and spend some time with that as well. Here is your foam roller. Just be careful, okay? So if you've never been on a foam roller, I like to recommend everybody just kind of ease your way down there. With the lower back, you're gonna wanna take some of your pressure off with your hands, so just kind of easing on it. Using your elbows, hips high, easing. And then you can just hold pressure. You can shift weight to one side. This may be a lot, depending on your fitness and where you're at. So if you're having a lot of acute lower back pain, I would say start with the lacrosse ball and maybe avoid this. If you're having slight discomfort or tightness after an exercise, maybe the foam roller would be a good ticket for you. Everybody's a study of one. It depends on where you're at on your journey. Okay, reach out if you have questions. Make sure you check with your doc if you're having back pain. While we're here, it's not a bad idea to support your head. Go mid-back. You'll get little clicks and pops in the spine as long as there's no pain when that happens. That's okay. And then you can even sit and just stretching out the lower back, stretching out the mid-back there. Great idea. And relax. With these, you spend a few minutes. Just kind of let the muscles do their thing. Then we're going to talk about a couple big stretches for the lower back. One of my favorite stretches is your back is flat, shoulders stay flat. You're just kind of relaxing, feet stay together. You're going to let the knees rotate to the side. And then you just hold that about 10 seconds. And then you work to the other side. Shoulders stay flat, about 10 seconds. A good flow off of the lower trunk rotations would be then bring your shoulders flat, legs to you, and you hold that for 30 seconds. And you do anywhere for this exercise. It's called double knee to chest. You can do 3 sets, 40 seconds, 30 seconds is great. Don't rush it. Let your body do its work. Next stretch we're going to talk about is one of my favorite. You're going to sit kind of in this cross leg position. You could also sit on a table with this leg on the table, other leg off the table. We're gonna sit tall. We're gonna square our shoulders. So we're gonna rotate our shoulders. This hand over here is gonna hold. This hand goes up, and you just lean. Here I feel a little bit in the hamstring. I feel this QL on the right side is tight, it's stretching. So I would just hold this for 30 seconds to 40 seconds, and then come out of that slow. And I would do the other side, 2 to 3 sets on each side. That's fantastic for the lower back. The next one is a kneeling prayer stretch, guys. So you're here, thumbs are gonna go up. We're gonna rotate our thumbs up. That puts our lats in external rotation. Remember, our lats tie in on our pelvis. If our lats are tight, they're pulling on our hips, which is pulling on our back. So thumbs are gonna go up, heels stay down. You do about 30 seconds here. You keep it at the same height. We inch it over, baby inches. And we do about 30 seconds here. And then we take it to the other side. Okay? Here's the money one. Always, always, always hip flexors. So you're here, roll your hips forward under you, lean forward. If the hips are tight, they are pulling on your back. I cannot emphasize that. Hip flexors, hip flexors, hip flexors. I don't care. Hold it for about a minute. Hold it for about a minute. If this is a tough stretch for you, put something under that knee to pad that knee, okay? Those are a few phenomenal recovery modalities to do post-exercise, post-hike. If you've been sitting in your office or you've been sitting in a chair, you've been sitting in a long movie, you've been traveling, when you get to your hotel room, run those stretches, guys. It'll make the day, it'll make such a difference. Remember, this is not a magic ticket. There are no easy pills, there's no red or green pill. There's the knowledge, and then you have to put it in place. Put this stuff in work. Don't do it once or twice and say, well, I tried it. No, you gotta do this stuff, guys, all the time. Woo! All the time. I hope this stuff helps you on your journey. Let us know if you have any questions. Play with the abdominal bracing. I'll chat with you guys soon. Have a phenomenal evening. I'll see you guys later.